Hey everyone, let's talk about something so many of us experience but often just push through: period pain. We're told it's just a part of life, to take a painkiller and get on with it. And yes, for many, mild cramps are normal. This is called primary dysmenorrhea. It happens when your uterus contracts to shed its lining, and substances called prostaglandins are released, causing those familiar cramps. It's usually manageable and lasts for the first couple of days of your period. But what if your pain is more than just normal cramps? What if it's so severe it makes you miss school or work? What if painkillers don't even touch it? This could be a sign of something else, what doctors call secondary dysmenorrhea. This type of pain is caused by an underlying medical condition. Let's look at some of the common culprits. First, endometriosis. This is when tissue similar to the lining of your uterus grows outside of it, on places like your ovaries or fallopian tubes. This misplaced tissue still acts like uterine lining. It thickens and bleeds with your cycle, but the blood has nowhere to go, causing inflammation, severe pain, and sometimes scar tissue. Then there's adenomyosis. Think of it as endometriosis's cousin. Instead of growing outside the uterus, the tissue grows into the muscular wall of the uterus itself. This can cause heavy, prolonged bleeding and intense, debilitating cramps. Uterine fibroids are another possibility. These are non-cancerous growths that can develop in or on your uterus. Depending on their size and location, they can cause heavy bleeding, pelvic pressure, and significant pain. We also have pelvic inflammatory disease, or PID. This is an infection of the female reproductive organs, often caused by untreated STIs. If not treated promptly, it can lead to chronic pelvic pain, not just during your period. So, what are the red flags you should watch for? Pain that gets worse over time instead of better. Pain that doesn't go away after your period ends. Pain during sex or when you go to the bathroom. And of course, extremely heavy bleeding that has you changing pads or tampons every hour. If any of this sounds like you, please don't just suffer in silence. It's time to see a doctor. A good doctor will listen to your symptoms, ask detailed questions about your cycle, and perform a pelvic exam. They might suggest an ultrasound to get a better look at your reproductive organs. In some cases, they might recommend a laparoscopy, which is a minimally invasive surgery to diagnose or treat conditions like endometriosis. Remember, you are the expert on your own body. If your period pain is disrupting your life, it's not normal and you deserve answers and effective treatment. Advocating for your health is so important. Thanks for watching, and please share this with someone who might need to hear it.